How do you think visual impairments impact education? As we proceed with this lesson, think about the various conditions and how they could affect education. Before we begin our discussion of educational implications for students with visual impairments, let's review some of the conditions. Keep in mind that there are many more conditions, but for the purposes of this class, we will stick to the ones introduced during the introduction and overview. First, we will describe a condition and show you an example, and then you should try to guess which condition we are referring to. What do you call the conditions that occur when the cornea and lens are not in sync? Here are a couple of hints. The cornea and lens cannot focus the image of an object sharply on the retina. Corrective lenses usually help with these conditions. The answer is refractive errors. Any condition that occurs when the cornea and lens are not in sync is considered to be a refractive error. What is the type of refractive error that results in being able to see nearby objects clearly, but distant objects are blurred? The answer is myopia, or nearsightedness. Myopia is a refractive error resulting in being able to see nearby objects clearly, but distant objects are blurred. What type of refractive error results in being able to see distant objects clearly, but nearby objects are blurred? The answer is hyperopia. Hyperopia is a refractive error where distant objects are clearly seen, but nearby objects are blurry. This is a refractive error where vision is blurred due to the inability of the optics of the eye to bring an object into a sharp, focused image. If you said astigmatism, you are exactly right. In astigmatism, both objects near and far are blurry. This condition results in a loss of vision in the center of the visual field because of damage to the retina. The answer is macular degeneration. The macula is the inner part of the retina, and damage to the macula results in a loss of vision in the center of the visual field. The next condition results from internal fluid pressure in the eye. Pressure builds up to the point of damaging the optic nerve. The answer is glaucoma. Glaucoma can be treated, however, it is not always completely successful. It is very important that it be treated as soon as possible because if glaucoma is ignored, the optic nerve can be permanently damaged. This next condition refers to improper alignment of the eyes. Although offensive, this condition may be referred to as cross-eyed or having a lazy eye. However, the correct term is what? Strabismus refers to improper alignment of the eye. As with other eye conditions, Strabismus can be treated. However, treatment depends on the severity of the condition and the patient's response to treatment. Remember that with all of these conditions, there is variability in severity and response to treatment. What is the condition that causes an inability to distinguish between certain colors? As you can see on the slide, the picture on the right portrays normal vision, and the picture on the left portrays a difficulty distinguishing colors. The answer is color blindness, and again, the severity can be variable. The following condition refers to rapid involuntary movement of the eye. Take a look at the following short clip and see if you can figure out what condition refers to rapid involuntary movements of the eye. If you said nystagmus, you are exactly correct. Individuals with nystagmus typically have some loss of visual acuity, which cannot be corrected with glasses. Many do see well enough to get information from written word. An important determinant of visual acuity for an individual with nystagmus is whether the person has a null point or semi-null point. The null point is a point where the person can visually stop or slow down the frequency of the nystagmus by looking a certain way. Surgery on the eye muscles can assist in making the eye gaze straight ahead. What vision problem results from having a cloudy film over the eyes? The answer is cataracts. In most cases, cataracts can be removed and vision will improve. Cataracts is often an age-related condition. However, some children have them. What do you call it when a person has a lack of peripheral vision? The answer is tunnel vision, or retinitis pigmentosa. Obviously, it's like looking through a tunnel. You don't see things to the sides very well. There are a number of factors that are going to affect the impact of a vision problem on a child's education. The first factor is whether or not the student has usable residual vision. It is important to make use of whatever vision a student has and encourage them to use it. A second important consideration is the time at which the vision problem developed. Also think about the importance of vision on language. If I lost my vision today, and you described to me a person with red hair, I would know what you were talking about. However, if I had never seen the color red and had no concept of colors, that would be a much more difficult concept to understand. Students who are born with visual loss have a much more difficult time understanding certain concepts and developing basic skills compared to students who lost their vision after they had established those concepts and skills. Vision screenings are typically conducted at school or through an optometrist or ophthalmologist. Screenings assess visual acuity and typically use a Snellen chart as the assessment tool. Any student suspected of having a vision problem should then be referred to an optometrist or ophthalmologist who will conduct further examination, including a medical examination and report. In addition, a clinical low vision examination will involve acuity tests, visual testing, an interview with the individual to gain further insight, and an evaluation to see if the student could benefit from low vision devices. Learning can be greatly impacted by vision problems. Therefore, it is important for teachers to be aware of the signs of vision problems and pay attention to behaviors, appearance, and complaints. It is important to be cognizant of the signs of vision problems because children may not realize they are having a problem. A child may think what they are experiencing is normal. Certainly none of these signs, in and of themselves, indicates a vision problem. Possible behaviors to look for include: is a child rubbing their eyes excessively? Is the child shutting or covering one eye? Are they tilting their head forward? Does a child have difficulty reading or difficulty doing anything else that requires close use of the eyes? Do they blink more than usual, or does it seem that their eyes get tired when they're doing close work? Does a child hold books close to his or her eyes? Is a child not able to see distant things very clearly? And do you see a child who squints their eyelids together or frowns quite a bit? With respect to appearance, how do the child's eyes look? Do the eyes appear to be crossed? Do they have red-rimmed and crusted or swollen eyes? Does the child have recurring styes? Does the child have inflamed or watery eyes? Teachers should also pay attention to complaints. If a child complains regularly that their eyes burn, itch or feel scratchy, or complain that they can't see well, this could be indicative of a vision problem. Furthermore, if they complain that they're experiencing dizziness, headaches, or nausea, especially after they have just done some close work, this could be another sign. These complaints should not be disregarded. Good teachers know and understand how important vision is to the learning process. Students with visual impairments may also have academic delays that are likely a result of restricted opportunities to visually interact with their environment and obtain information. Unlike their sighted peers, incidental learning as a result of interacting with the environment is limited. This lack of incidental learning skills and opportunities can impact the development of motor, language, cognitive, and social skills. They will also have a limited range and variety of experiences, ability to get around, and interactions with the environment.